So there you go. Austerity was a lie all along. It was a political choice that the ruling class made. How do we know this? Well, in the last week we've seen Varadkar say that the common good can usurp property rights. In the face of the Covid-19 crisis, neoliberal policies, Thatcherite policies have been forced into retreat because they don't work when faced with a crisis like this. To deal with Covid-19, you need a functioning public health service, and so Varadkar has to temporarily take over some of the private hospitals. And yet for a decade they made the opposite argument. For the last 10 years, every time the left said, freeze rents, build public housing, we need a single tier health service, Varadkar's reply is, oh, we can't do those things, it's unconstitutional, we can't do them. And now suddenly we see that that was just bullshit. He was talking shite to defend his mates in the banks, to justify kicking us through austerity. But now this virus threatens the rich and the poor. Anybody can get sick, and suddenly things we were told were never possible suddenly become possible. The EU, which used its treaties to ban public spending, now lifts that ban and says, well, you know, if you want to stimulate your economy with billions and billions of euro, go ahead and do it. We have to keep the system functioning. And they say that we have to use such measures because this is an emergency. So 10,000 people homeless. A young boy eating his dinner on a piece of cardboard outside the GPO because his family are homeless. That wasn't an emergency. Watching our grandmothers and grandfathers after working their whole life die on a trolley in an underfunded hospital. That wasn't an emergency. Now Varadkar and co will say they're looking forward to getting things back to normal. Well, I say I never want things to go back to normal, because back to normal wasn't working. We need a completely different way of doing things and a completely different way of organising our society. After the 2008 crisis, we had 200,000 empty houses and tens of thousands of people needing a house. But you couldn't put the two things together. In a rational, planned society you could, but under capitalism, no, those 200,000 houses are owned by developers, who then pass them on to NAMA for a nice little monetary reward. And then what does NAMA do? Sell them back to the same developers or onto vulture funds, who then make a fortune with exorbitant rents. After the 2008 crash, we had rusting and empty workplaces because the boss who owned it pulled out his investment and sacked all the workers. So you've got machinery sitting there rusting and workers looking for a job. In a rational society, you could put the two together and make things that society actually needed. But no, you can't do that under capitalism, because the individual who owns the machines and owns the factories and owns the offices doesn't want to invest right now. So we wait at his whim. Right now, there are massive hoards of wealth, technology, buildings, all the things we need to fight Covid-19 in the hands of private individuals all over the world. But we can't take them and use them for the common good, because no, you can't do that under capitalism. The profit motive, putting profits in the pockets of wealthy private individuals, is not a rational way to plan any society. Leaving billions of people at the whims of a tiny percent, the 1% at the top, is not a rational way to plan a society. If you accept the argument that a rationally planned society, that a rationally planned health service is necessary to take on the Covid-19 crisis, then why not extend that argument and say to yourself, a rationally planned society is what we need to take on the housing crisis. A rationally planned society is what we need to take on poverty. Do you think we should mobilise all of society's resources to solve the housing crisis, the health crisis? If we had a democratically planned society, we could immediately take over production facilities to produce ventilators and make sure that no doctor had to make a choice between who got one and who didn't. We talk about flattening the curve, that there's a line that represents how our health service can cope with Covid-19, and we don't want the amount of cases to go up over that line. Well, we can flatten the curve, but we could also raise the line by improving investment in our health service so that it can cope with more cases. The neoliberals and the right-wingers would have you believe that that line is stuck where it is and you have to flatten the curve below it. But let's flatten the curve and raise that line. The basic idea of socialism is that the people who produce the wealth in society should have a say in what's done with that wealth. It's not scary, it's not sinister, it's simple. The basic idea of capitalism is that the economy is run in the interests of a tiny little elite who make billions and stick trillions into tax havens while we work our arses off for nothing. To deal with this crisis, and the housing crisis, and the health crisis, and the crisis of poverty, and the recession that's coming, the working class needs the keys of the economy. We have to take the keys off them. We have to get behind the steering wheel. That's socialism in a nutshell, and that's what we need.